And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Well, good evening and welcome to Boomer Life here on CIL 650. I'm Sterling Fox, and on this episode of the program, we're focusing on your health with the very capable assistance of Dr. Paul Zickler from YesWellness. Dr. Zickler, good to see you again, sir.
Nice to see you too, Sterling.
Tell us your story. You're a very interesting man. You're a White Rock, Crescent Beach sort of fellow nowadays, but you've spent a lot of time in Westminster heading up the emergency department at Royal Columbian in your medical career.
Oh, that was a long time ago. That's a long time ago, Sterling. Yes, but I did work for the first part of my career at the Royal Columbian Emergency Department for about 18 years, and that was the most exciting time to be actually working in the emergency department because we were never clogged up. We were always open for business, where the backlog of patients that we're seeing now with no place to put them wasn't there. And so that was exciting, and everybody worked as a team to keep people moving, and there were a lot of things being developed. The ambulance service went from pickup to paramedics.
Right.
We went to establish the air ambulance.
Which is still a regular fixture out of Royal Columbian. I live in Sapperton, very close to the hospital, and we see that air ambulance several times a week. You know, it's an interesting thing. Every time I see it, I go, it's a bittersweet feeling, because here we have this fantastic piece of technology able to swoop down and grab some poor person up off the road or wherever and whisk them off to hospital. The problem is when you see it take off, somebody's in real trouble.
Yes, exactly. It sure is. So that's a big development. And so just as you've noticed the change in the actual hospital structure,
indeed,
so too did emergency medicine develop. And now with the new department, the technology, it's so much different than when we started. But we were there at the beginning, and it was the exciting time when we were involved in the helmet legislation, seatbelt legislation. We were developing the actual specialty of emergency medicine, which now is a full-blown specialty.
And at that time, was RCH, Royal Columbian, was it the Lower Mainland's major trauma center?
We were for the Valley.
Yeah, okay.
I mean, we've always been the major trauma center, and it still is for the Valley. Down VGH and St. Paul's,
for the city.
For the city,
okay.
Exactly. And so anything from east of New Westminster was our domain, right? And it still is.
But in many ways, because you were an engineer, an emergency room surgeon.
No, physician. Yeah.
During the time of all of this development, in which you had input into developing legislation, into developing new emergency policies and procedures, and this, of course, on top of the workload of running an emergency department at a major urban hospital, what an exciting period in anyone's medical career.
Yeah, it was truly exciting. It was the most exciting part of my career. However, over time, that things did change.
Sure.
And I think it primarily started when there was a problem with transfer payments from the federal government to the provincial government. All of a sudden, what the provincial government was expecting was drastically cut. And so then we started the cutbacks in terms of the beds, the size of hospitals, the services. Mm-hmm. And
I believe now that it's referred to as rationing healthcare, isn't it?
Well, I guess it's a matter of what you want to label it, but it's in terms of what we can afford.
Right, exactly.
And from those exciting 10 years in the emergency department, all of a sudden things got bogged down.
Right.
And so instead of everybody working together to manipulate the hospital system to get people moved, all of a sudden we're seeing the emergency departments being backlogged with admitted patients and ambulances waiting to get into the emergency department. Now the ambulance attendants are attending the patients in the ambulances waiting to get into the hospital.
Right.
There are stretchers in the halls,
mm-hmm.
and the physicians now are attending to them everywhere. And so that created a completely different environment and completely different kind of stress to those working in the emergency department. I was acutely sensitive to that, and with the night shifts and this added stress, it was sort of telling on me. But there was one incident, one Saturday night, that was the tipping point for my career.
Tell us about it.
Well, it was a busy night, and at that time there is only one physician on for the whole night, for the whole department. Now there are many more.
Right.
And so we got a very bad, critically injured motor vehicle accident. A 17-year-old young gal who was badly injured, multiple big bone fractures, and she was paraplegic from a lower spine fracture. And we stabilized her, and this was probably happened around midnight.
Mm-hmm.
And we stabilized her, and it took me all night until the next morning at 10 o'clock. My shift finishes at 8, and I was still trying to get a place for this young woman, and I had to spend the whole night with her, as well as the parents and the family, telling them how sick she was and
Right.
the fact that she was paraplegic. And I remember having to sort of get on my hands and knees to get this first-year resident to finally give me a bed in an ICU downtown because there's no beds anywhere else.
Oh.
And I finally got her a bed, and I came home that morning to my wife, and I said, that's it.
Right.
I can't take this anymore.
This after 18 years,
Yeah.
one should hasten to add. It
Exactly.
wasn't any kind of overnight thing, was it?
Yeah, it was a turning point for sure. And if they were able to say, "Listen, Paul, you can just take care of the medicine, but all this other
The politics.
all the politics and the backlogs and the waiting times, I could foresee myself still continuing to do that."
Sure.
But after that, was I sort of looked at my career and looked at my stress levels and said, I've got to change my life.
And so what sort of changes did you make?
Well, it was interesting because once I started talking to my colleagues, and I was a big advocate to change the schedule. We had terrible schedules, and I was a big advocate in terms of shortening the night shifts because they weren't healthy at all for us. But being young, we're all in our late 20s, early 30s. None of us really thought of that, but I was very cognizant of that. And it was interesting once I said to my colleagues, I'm going to be leaving. I'm going to be doing. What I'm going to do is I can't see myself being sort of an office doc.
Right. Because it was the office stuff that drove you crazy in the first place.
Yeah. And so then I said, why don't we look at a concept of an urgent care where we're basically like a minor emergency department where we're going to do suturing, putting casts on, seeing the walking wounded, referring people back to their family doctor.
In some kind of clinic environment then?
In a clinic environment. So lo and behold, 4 others decided to make the change at the same time.
Oh, okay.
So up until that time, nobody really had discussed about leaving the emergency. But once we started the conversation, others had the similar idea and saying, hey, you know what? I think I've had it with this stress.
So did the clinic eventually come to pass?
Yes, we did. We opened our first clinic in Langley at the Glover Medical Clinic, and it worked really well. This was at a time when there weren't really any walk-in clinics.
Mm-hmm. And so what year basically, or roughly, would this be?
Gee, that would be probably the early 1990s.
Okay.
Yeah.
And you're right. Walk-in clinics were not a big deal, not as well certainly available as they are today.
Yeah. So it created a stir in the community. And it created a stir with our patients, and it worked really well, we thought. But the problem was that, just as anything, you can't take things in isolation. Mm-hmm. So we had our policies set up, but in terms of the follow-up, things weren't sort of adapted. So we say I sutured you up on Monday. Mm-hmm. Your suture is supposed to come out in 10 days.
Right.
Well, you phoned the doctor's office. You couldn't get in to see the doctor. So, I'll just come back to us to take the sutures out. Well, that's not what we intended, but that's what happened.
Oh.
And so then people started walking in to do their regular things that they would normally see their GP. Because they couldn't get an appointment, they wanted to be seen today, it was convenient for them to come in. So
can I just ask you an aside question?
Sure.
Because we do this, we hear stories of it because so few of us have family doctors. You emergency room people must go just crazy from time to time with the number of people that show up at Emerge with stuff that the family doctor should. This is not an emergency. And so people started to use your emergency clinic in Langley in exactly the same way. And you must have recognized those symptoms pretty quickly.
Yeah, absolutely. And so the whole evolution of walk-in clinics have now reverted to one where it's a family practice walk-in. And I think that's it's really a healthy situation where there's a continuum and people do have family doctors and that there's a continuum of care. But at the same time, there is still lots of people that don't have a specific family doctor relying on walk-in clinics where there might be a change of doctors and they won't get the same doctor. But even if you stay at the same walk-in clinic, at least your chart's there and your history is there. And if you're seeing different people, hopefully there is some continuum.
Right.
So
you had the one clinic in Langley. Did it expand to more, or did that experiment suffice?
Yeah, we still thought we could make this idea work, and we opened one in Maple Ridge. We opened one in sort of South Surrey.
Okay.
But what happened is that as we needed more medical personnel, doctors, to fill in those spaces, their level of experience of dealing with lacerations and casting and acute things, nosebleeds, what have you, the things that we could do in our sleep.
Sure.
That wasn't necessarily what the young doctors had experienced and had some experience in dealing with.
Right, and especially in some kind of urgent care environment.
Exactly.
Right?
So then it defeated the purpose because then, people were coming in to be sutured, but that wasn't the level of expertise of that particular doctor, and they sent to the emergency department. Well, that's what we were supposed to be doing.
We're replacing, exactly.
Yeah. So then we finally ended up with two clinics, and then we split that, and two groups sort of went different ways.
Okay.
The Glover and the Peninsula, and then my partner left. He was going back to move back east, and I decided, well, I think I'm going to change my situation again. And again, there was another tipping point in that change.
Okay.
And so I the same way when things changed in the emergency department, becoming more clogged up, more politics, not being able to do what I could do as a physician, with stress of other things that are out of my control. So too, things start happening in our urgent care clinic. It became a family practice clinic.
Right.
And you're under the constraints of seeing patients in so many minutes and getting on with it. And it was very unsatisfactory. I mean, I was basically writing prescriptions and giving advice to people which they weren't taking, and coming back for more pills.
Now, you described a tipping point involving that 17-year-old girl from your 18 years in the emergency department at Royal Columbia. What was the tipping point that got you to reconsider your urgent care clinic calling in this instance? What brought you to the next level?
Well, you can sort of deal with some dissatisfaction in your life for a certain period of time, but then when you start looking at other avenues and you open your mind to alternatives, it's amazing what can happen. And so that tipping point was when my daughter announced that she was going to go into naturopathy and be a doctor of naturopathy. And I looked at her and I said, "Are you sure?" And she said, "Yes, absolutely." And then I really didn't really know what naturopathy was.
Right.
But
she wanted to become a naturopath. Were you a little disappointed that she didn't want to become a physician like in the Western Orthodox tradition like her dad?
Well, I was initially, but once I really started to look at what actual naturopathy was and what they studied and how they studied and where they studied, I started becoming very intrigued in terms of looking at the whole new range of avenues of how to treat people.
So, what's the big difference? What would a naturopath's view of a situation? How would it differ from a traditional orthodox Western doctor, which you are, and that's your medical background? So you know what that mindset goes to immediately. How would that differ from the way a naturopath would approach a situation?
Well, to put it simply, is that the focus of complementary medicine is to look at the root cause and to treat the cause of a disease, or to prevent the disease in the first place. So wellness.
Oh, okay.
Whereas the focus of conventional medicine or allopathic medicine is to treat the symptoms with pharmaceuticals.
Right.
As well as the acute side in terms of the trauma acute care, and that nobody's going to compete with that.
Of course,
that level of care and that kind of care is not reproducible in the allopathic side.
Right.
But if we're looking at the biggest concerns these days is chronic illness.
Right. There's
a huge role.
Our guest from YesWellness is Dr. Paul Zickler with quite a story attached, I must say. And we're just getting warmed up here because we've just got through Dr. Paul's career to the point where he is about to join and organize YesWellness, which is what we're going to talk about for the balance of this hour. So we'll take a quick break here and come right back. Stay with us here on BoomerLife.